Hello guys, this is Monica from Ignited Medicos. Today we learn about the inborn errors of the phenylalanine and tyrosine metabolism. Several enzyme defects in phenylalanine leading to the metabolic disorders. The first disorder is of phenylketonuria, then the tyrosinemia type 2, neonatal tyrosinemia, alkylptonuria, tyrosinemia type 1. Now we will see the phenylketonuria. This is the most common metabolic disorder, 1 in 10,000 births. It is the inability to convert phenylalanine to tyrosine leads to the phenylketonuria. The metabolic defect, the absence or the deficiency of the phenylalanine hydroxylase. There are some types in the types in it. The classic phenylketonuria is due to the defect in phenylalanine hydroxylase. Type 2 and 3 are the defect in dihydrobiopterin reductase, and type 4 and 5 defect in the dihydrobiopterin biosynthesis. Now, the metabolites that accumulate in phenylketonuria. The phenylketonuria primarily causes accumulation of phenylalanine in tissues and blood. Due to disturbance in the routine metabolism, phenylalanine is diverted to alternate pathways, resulting in excessive production of phenylpyruvate, phenylacetate, phenylglutathione. Here, the phenylalanine, which converts to tyrosine, we need the enzyme phenylhydroxylase. But in phenylketonuria, this enzyme is blocked here. Then, the phenylalanine gets converted to phenylpyruvate. The phenylpyruvate, through reduction, phenylpyruvate through oxidation and decarboxylation, it converts to glutathione. Phenylacetate, through conjugation with the glutathione, it gives phenylacetyl glutathione. Then the biochemical manifestations in phenylketonuria. The disturbed metabolism of phenylalanine, resulting in the increased concentration of the phenylalanine and its metabolites in the body, causes many clinical and biochemical manifestations. First, the effect of the central nervous system. It affects the mental retardation and low serotonin level, effect on pigmentation. The hypopigmentation. The melanin is the pigment synthesized from the tyrosine by thyronase. Accumulation of the phenylalanine competitively inhibits the tyrosine and impairs the melanin formation. This results in the hypopigmentation that causes light skin color, mousy odor of urine due to phenylactate. Now, the diagnosis of the phenylketonuria. Phenylketonuria is mostly detected by the screening of the newborn babies for the increased plasma levels of phenylalanine by the Guthres test, which is a bacterial bioassay of phenylalanine. Guthres test is performed after the baby is fed with the breast milk for a couple of days by testing evaluated estimation of blood. The normal level is 1 to 2 milligrams per dl. In phenylketonuric persons, it will be more than 20 milligram per dl. It can be demonstrated by the chromatography. Phenylpyruvate in urine can be detected by the ferric chloride test. It will be in a green in color. Then the prenatal diagnosis of phenylketonuria is done by the DNA probe. And the treatment for the phenylketonuria is damage to the brain. Early diagnosis and treatment for 4 to 5 years. Now, the second type of disease, the tyrosinemia type 2. It's also known as the Richter-Hanhart syndrome. The defect is in the enzyme of tyrosine transaminase. The accumulation and the excretion of tyrosine and its products takes place. Clinical features are the eye lesions, rarely mental retardation, disturbed self-confidence in the patients. Then there is a urinary secretion of tyrosine and abnormal metabolites of tyrosine like para-hydroxyphenylpyruvate, para-hydroxyphenyl lactate, para-hydroxyphenyl acetate, N-acetyl tyrosine, and transamine. The next is of neonatal trisonemia. Metabolic defect is the absence of the enzyme para-hydroxyphenyl pyruvate dehydrogenase, the temporary condition and the response to the absorbic acid. The risk factor to this disease is the premature baby, the dietary vitamin C deficiency, high protein content. The clinical features are the blood levels of tyrosine and phenylalanine are elevated. Urinary levels of the tyrosine, para-hydroxyphenyl lactate, N-acetyl tyrosine and triamine. The treatment is the low protein diet. The fourth disease is alkylptonuria. It is also called as black urine disease. It is an autosomal recessive disorder. The metabolic defect it lacks the enzyme called homogenetisase oxidase enzyme. 1 in 2.5 lakh births. Homogenetisate converts to malolactoacetate through the enzyme homogenetisase oxidase. In this disease, this enzyme is blocked. The urine of alkylptonuric patients have or resembles coke in color. Homogenetisate is oxidized by the enzyme polyphenol oxidase to form benzoquinone acetate, which polymerizes to form a pigment called alkapton. Late in this disease, there is a generalized pigmentation of the connective tissues in bones and the various, which is called as achronosis. The diagnosis is the urine becomes black in standing, the ferric chloride test, and the silver nitrate test. The treatment of this disease is consumption of a low phenylalanine. Alkylptonuria is a beginning condition. The patient leads a normal life except that the urine becomes black. However, the consumption of the low phenylalanine in diet is recommended. The next disease is tyrosinemia type 1. It is called as hereditary tyrosinosis or tyrosinosis. The metabolic defect. The defect is in the enzyme called fumarate lactoacetate hydrolase enzyme. The cause is caused the liver failure, rickets, renal tubular dysfunction, and polyneuropathy. This disease is rare, but it's a very serious disease. There are two types of tyrosinemia type 1, the acute tyrosinosis and the chronic tyrosinosis. The acute, where the infant exhibits diarrhea, vomiting, and a cabbage-like odor. It may lead to the death within 6 to 8 months. The chronic tyrosinosis, same symptoms, but it is in very mild. In this, the death can be by the age of 10 years. The treatment to this disease, it should be the diet containing low in tyrosine and the phenylalanine. Then the albinism, the defect in the synthesis of the pigment called melanin. It is an autosomal recessive disorder, the 1 in 20,000 births. The biochemical basis are the deficiency or the lack of the enzyme tyrosinase, decrease in the melanosomes of the melanocytes, the impairment in the melanin polymerization, limitation of tyrosine molecules, the presence of the inhibitory of tyrosinase. The most common cause of the albinism is defect in the tyrosinase enzyme. The clinical features in this disease is the skin and the hair becomes white, increased susceptibility to the skin cancer and the photophobic. No treatment is in the sight of the albinos. Here, photophobic means intolerance to light due to the lack of melanin in the eyes. This is the disease showing tyrosinemia type 2. It is characterized by skin and eye lesions and rarely mental retardation. A disturbed self-coordination is seen in these patients. These are the symptoms showing alkylptonuria. Urine becomes black on standing. This is a simple traditional test. This is due to the oxidation of the urinary homogenetic acid on exposure to air. Then ferric chloride test. When FeCl3 is added to urine, it turns green. This is a non-specific test because even phenylketonuria also give a positive FeCl3 test. The disease in the picture shows albinism. The skin and hair becomes white. The most important function of the melanin is the protection of the body from the sunlight. Thank you guys for watching this video.